Hello and welcome to the Pre-Chiro podcast. I'm your host, Dr. Ben Glass, and today we're making a professional chiropractor connection out in Florida with Ian Shtulman. Ian, can you get us started by just introducing yourself and reflecting on that time of life where you decided you wanted to become a chiropractor?
Sure. I'm actually a second generation chiropractor. My dad grew up in New York and went to New York Chiropractic College, graduated in 1982, moved down to South Florida, had me. And, I've been fortunate enough to be adjusted my whole life. I didn't really understand the significance of that. My dad went to NYCC and left with this idea that those chiropractors at life who don't diagnose aren't smart enough to diagnose. He really had a very medical mindset in practice and viewed chiropractic through the lens of like a natural orthopedic type of practice. But because, chiropractors adjust their kids, he was able, he took care of me my whole life. It wasn't until, 19 years later, and I'm a sophomore at University of Florida, doing my pre-med stuff, getting ready to be an orthopedic surgeon myself. And my dad decided to go to Total Solution. He bought an Insight subluxation station and he went to Total Solution. He started learning more about this thing called chiropractic, right? He started learning more about the philosophy. He started learning more what happens when we put our hands on somebody and we adjust the subluxation. And all of a sudden, these stories from practice started to click in his head. And he came home and he put together a CD for new patients, like a lay lecture. And he put it in to the CD player back when cars still had CD players, as we were driving up to drop me off at school. And I remember listening to the chiropractic message, the chiropractic story for the first time in my life. And all of a sudden I realized, oh my gosh, this is why I was never sick as a kid. This is why, our family is the way that we are compared to everybody else. And I decided right then and there, I said, this is what I want to do. I want to take care of people through chiropractic, and I want to help their bodies express life more fully.
Mm.
And he sent me to Life University in Atlanta, Georgia. While I was there, I became super passionate about the impact chiropractic can make on pregnancy and pediatrics. And I decided that was going to be my life's mission, that I was
Mm.
going to serve humanity by creating the next generation of subluxation-free, people.
Mm.
And I moved down to South Florida after graduating. I opened up practice and very quickly found myself as the staff chiropractor at a local birth center. Started working with a lot of families and a lot of providers, and gradually things snowballed. And 11 years later, I now teach for the ICPA. I've been in practice with two offices, multiple associates, and it's been quite the ride.
Hmm. Can you reflect on that moment when you were studying to be a pre-med or you were studying to go to medical school? Where were you at in the program? And when your consciousness shifted towards chiropractic, like how hard was it for you to transition in that direction? Did you have to completely did you have to take additional classes? Did your major actually prepare you perfectly just to go and basically the same prerequisites for both paths, and also like what did you do at that time in between arriving at chiropractic school and deciding you wanted to become a chiropractor?
So, I was doing a lot of the basic pre-med classes. My major was applied physiology and kinesiology, and I used to joke that it was just a fancy way of saying PE. So it was very much suited for pre-med or pre-chiropractic program. So I didn't have to change any of that, but I did have to change my mindset. Um, the thing that makes chiropractic so unique and so important is its philosophy. And I grew up experiencing the benefits of chiropractic, but not fully understanding the philosophical reason for it, right?
Hmm.
I knew that being adjusted allowed my body to be healthier, and I was, able to benefit from that my whole life. I just didn't understand why. And so I started listening to On Purpose CDs with Christopher Kent and Patrick Gentempo. And I started better trying to understand this chiropractic thing, and not only what makes it chiropractic in terms of the application of the adjustment, but what makes it chiropractic in terms of the philosophical underpinnings of the profession. Why do we exist? Why is this important? What is our purpose? And that's what really gave me the confidence when I started chiropractic school to really have a clear idea of what chiropractic is. I think too often people go into chiropractic school having a general idea, maybe they've been adjusted a couple of times, but they don't really have that solid foundation of this is what chiropractic is, this is what everything else is. And I think understanding that philosophy is so important because it dictates everything about your professional life. It dictates the techniques you choose. It dictates how you communicate with your patients. It dictates the way you market or share your work with the world. There is no part of your professional career that is not going to be influenced by your philosophy. The only question is how much do you define your philosophy, or how well do you understand it?
Mhm.
The reason, 11 years into practice, 80% of our new patients are pregnant women. Um, we really don't take care of many dads. If they're existing patients, sure, but we really don't take care of a lot of single men. We don't have anybody who's Medicare age. We don't do car insurance. We don't do, auto accidents or any of that. And we just deliver pure, unadulterated chiropractic, right? And the only reason why we're able to do that is because my philosophical understanding of chiropractic was so clear that when I experienced those challenges early in practice, I was able to say, no, this is what I do. This is who I am. And I just kind of planted myself, and everything that came at me, I was able to just say, no, this is who I am as a provider.
Mm.
Um, and so I work with I work with other people, but my role is the location analysis and adjustment of the vertebral subluxation. And that's
Mhm.
something that I do that nobody else, does in terms of other healthcare providers.
Mhm.
And it is something that is valuable, and it's something that is necessary and wanted, and it's a distinct approach. And so all of these things are really what's allowed me to be successful, is that philosophical understanding.
Mhm.
So that started honestly before chiropractic school, but it really became a firm part of who I am in chiropractic school, especially in those first couple of years. Um, Too often, my dad included, go out into practice and they try to practice and they may not ever understand the philosophy or have it defined for them. And I think that's a big problem. Start first by defining the philosophy and really understanding it, because everything else is going to emanate from that.
Mm. So when you arrived at school, you had already been pre-primed. Like, what were you able to be aware of that helped you once you got to school? Like, what were you able to just dive right into and go deeper than most other students because you were already aware that you were clear that this is the direction I'm going? And then how did you get turned on to pediatrics and pregnancy? Like, was that prior to school, or was that when you got to school? And if so, like, what was the origin story behind that?
So we were in first quarter. Um, it's actually kind of an interesting story, because I was in chiropractic school the first quarter, and you're doing all like medical terminology and basic anatomy and all of those like early stuff just to kind of get familiar with what you're about to study. And it was about week 5, right around midterms, and I was just feeling so like apathetic towards everything. I'm like, man, when do we get to put our hands on people? When do we get to start, adjusting people? And a friend of mine said, well, why don't you come to one of the clubs? It was the Pierce Results Club, and the advisor happened to be David Koch, who is the philosophy instructor at Life. And I'll never forget, he started the club meeting by reading from a green book, which I had never seen before, I'd never read before. And he flipped open The Bigness of the Fellow Within, chapter 11, called This Inner Power Speaks. And I'll never forget. And if you'll give me a moment to recite it, um, it says, "We chiropractors work with the subtle substance of the soul. We release the prisoned impulse, the tiny rivulet of force that emanates from the mind and flows over the nerves to the cells and stirs them into life. We deal with the magical power that transforms common food into living, loving, thinking clay, that robes the earth with beauty and hues and scents the flowers with the glory of the air. In the dim, dark, distant long ago, when the sun first bowed to the morning star, this power spoke and there was life. It quickened the slime of the sea and the dust of the earth and drove the cell to union with its fellows, producing countless living forms. Through eons of time, it finned the fish and winged the birds and fanged the beasts. Endlessly it worked, evolving its form until it produced the crowning glory of them all. Through tireless effort, it blows a bubble into each individual life and then silently, relentlessly dissolves the form, absorbing the spirit into itself again. And yet you ask, can chiropractic cure appendicitis or the flu? Have you more faith in a knife or a spoonful of medicine than the innate power that animates the internal living world? Right? Like my head just exploded when I first heard that, because I experienced all of that growing up, but I didn't really understand the connection. I didn't understand that there's this power in the body that takes a single half cell from a sperm and a single half cell from an egg, putting together to create one single human cell. And that cell divides and divides and differentiates into heart and lungs and limbs. And the nervous system regulates all of it. And that if the spine is interfering with that nervous system, it limits that power, that intelligence from being fully expressed. And as a result, our body is not as capable of adapting and coordinating and regulating and healing as it's supposed to. And that's what contributes to chronic sickness, chronic disease, all of these things that plague our society. And that through a gentle, specific chiropractic adjustment, we can release that prisoned impulse. We can restore that normal nervous system capacity to help facilitate improved function and adaptability and overall health and well-being. And so for me, like when I heard that, it just became so much bigger than natural orthopedics, right? It became so much bigger than we're gonna help prevent your back pain, or we're gonna help treat you so you feel better. It became about helping people become the full expression of themselves.
Mhm.
And a couple weeks later, I was able to hear Jeannie Ohm. And I'll never forget sitting in that room, listening to her talk. And she was so passionate about the role of chiropractic in serving pregnancy and the birth and postpartum for both mom and baby, that I left that meeting and I just said, this is what I need to do the rest of my life. And so that's really the moment when I said, yeah, gosh, man, pregnancy is so amazing. It is the full expression of innate intelligence. And these kids are starting life in a subluxated, compromised, less adaptable fashion. And if we can do something about that, it's going to allow kids to grow up and not have to heal from trauma, but be able to grow up without that accumulated trauma. And it just became something that said, man, this is what I'm going to do the rest of my life. There's no doubt about it.
Mm, mm. Can you talk about your upbringing just as a child and how you bring that with you into practice of like caring for kids, like relating maybe some of the experiences you remember from your childhood and how you maybe share that as a example, or you just bring that with you into practice? Because so much of our story, so much of our background comes with us into the practice that we develop for ourselves.
Yeah. It's funny because, like I said, I grew up and I never really understood why I was getting adjusted. It was just something that you do. And I always remember being confused, like, well, what do you mean your dad doesn't adjust you, right? Like, what do you mean your parents don't, bring you to a chiropractor? Um, and I can't say that I grew up with like the chiropractic philosophy as the guiding force in our household. I mean, I was vaccinated growing up. I remember getting antibiotics every once in a while. But the reality is, compared to my peers, I was rarely injured. I was rarely sick. I mean, I remember all throughout high school begging my parents to let me stay home because all my other friends can stay home when they're not feeling well. Why can't I stay home? Even if I feel fine, like I want a day off, I want a break. So my parents ended up giving me mental health days where I can just kind of say, all right, I'm staying home today because I just need a break. Simply because I was just always, I never had like an excuse as far as like, oh, I'm sick, so I have to stay home. Uh, and I see that with my kids now. I've got a 5 and a 7-year-old, and um, you know, through chiropractic, they're able to be exceptionally healthy and adaptable. And, they're 5 and 7 now. Neither have ever had a medication. Um, I'm not opposed to that stuff when it's necessary, but I think too often in healthcare, we do things not because it's necessary, but we do things because that's the tools we have.
Mhm.
The big thing that I think from a professional standpoint, medicine is the diagnosis and treatment of disease. Um, they're not the promotion and restoration of health. Uh, the problem that we have as a profession is we try to take the chiropractic adjustment and turn it into a modality for the treatment of disease. But that's not what it is. Chiropractic is about the release of interference to the nervous system. It's about facilitating proper function and adaptability in the body so that the body can heal itself, so the body can tap into that innate intelligence.
Mhm.
You take that and try to apply it to disease treatment, and you're not going to get the results that you're looking for. We've all had people in our practice who start getting adjusted and their body heals and they recover from symptoms and disease. But that's not what the intention should be, right? The intention is facilitating normal function so that the body can heal itself. And so in the case of my kids, I look at them and, when they're sick or when they're not feeling well, and I say, okay, cool. Is your body adapting? Right? Like, yeah, you got a fever, but your body is using that fever to help fight infection, help you feel better, and help your body recover. So my question is are you adapting to that fever? Is that fever appropriate? Are you well adjusted? Are you hydrated? Are you otherwise, responding well? And, the answer has always been yes. Right. So we don't do any medication. We don't do anything to interfere with the body.
Mhm.
There are, I think it's that philosophy that there's a clear distinction in my head of before chiropractic, really understanding the philosophy, and after. I remember I had like impetigo, or like a staph infection when I was in undergrad, and they gave me a prescription for Keflex, an antibiotic, and I distinctly remember that was the last medication that I've taken, and that was in 2008. No, 2004. Um, and I learned about the chiropractic philosophy, and all of a sudden it became, oh, well, what can I do to facilitate healing in my body instead of what do I need to do to suppress symptoms and disease? So I
Mhm.
think the transition really happened while I was in chiropractic school, or even before chiropractic school, while I was learning that chiropractic philosophy, and
Mm.
that's become the guiding principle in how I practice and how I raise my children.
Mm. Mm. Can we shift back to the specialized training that you engaged in practicing pediatric pregnancy care,
Yeah.
knowing how to touch a baby, a toddler, a teenager? What types of training did you engage with? Do you have any resources that you can maybe throw out there that were super valuable for you?
So the single most important thing that I've done in my professional career is the ICPA curriculum. The International Chiropractic Pediatric Association is the leader in the world on perinatal chiropractic, right? Family wellness chiropractic. And I took all of the modules while I was in chiropractic school. And it gave me the confidence, not only in terms of that chiropractic is valuable and necessary in these populations, but it also gave me the confidence in how to communicate with parents and providers. Um, it gave me the confidence that I can walk into a birth center, freshly graduated, a 25-year-old guy without kids, and I can walk in and meet with this seasoned doula and midwife and immediately present myself as the person who they need in their practice. Um, because I walked in knowing that what chiropractic was, what we could do, and how important it was to this population. The actual technical skills are not difficult, right? Like, yes, there are levels of specialization, and you can go down the rabbit hole and go into all sorts of in-depth, technique analysis and all of that. But for most people, you can take a weekend seminar, take Pamela Stone's Webster class, take Armand Rossi's pediatric adjusting class, and you can feel competent enough to go and take care of these populations. But the more you go into it, the deeper your confidence is, because the hard part of chiropractic, and maybe you'll agree to this being in practice yourself, the hardest part of chiropractic is not the actual process of delivering an adjustment and helping people get well. It's getting an opportunity to do so. It's talking with a family and having them hand over their 3-day-old baby and say, yes, please adjust them. It's about a mom who's had miscarriages and losses come into you at 32 weeks and say, please adjust me so that I can prepare for birth. Um, it's the confidence that you have to have these conversations so that people trust you. And I don't think there's any source that's better than the ICPA at helping instill that confidence in being a provider of families. So I did it while I was in school, and a couple years after that, I took the certification exam, and I got my CACCP, the certification from the Academy of Chiropractic Family Practice, and then I went and got my diplomate in chiropractic pediatrics after that. So whether you are in chiropractic school or you are recently graduated or you've been in practice for 20 years, the best resource that I could tell you is look up the ICPA and see where you can start, right? Because it doesn't take a lot to get into. It's one of those. I don't know if you ever remember the board game Othello. Where you put down like a little black or white piece and you flip the ones in between. But I remember there's a slogan on the box that says, a minute to learn, a lifetime to master. And I think about that in terms of pediatric chiropractic, because it's not difficult to get into. But the more you do it, the more you realize that there's more to learn, and it's a never-ending process. I'm continuing to learn from people, from friends and colleagues and mentors. And I think that's what makes it so exciting, is that there's never a point where you stop.
No doubt. Yes. Thank you for that message. Can you reflect on just transitioning into the real world, some of the biggest challenges you personally faced? It seems like a lot of these transitions were relatively smooth for you just because you did the work prior. But can you maybe talk about either challenges and obstacles that you had to overcome for yourself, or that you witnessed and observed in your peers?
So here's the thing. Everything seems better after, right? Like in hindsight, I look back on it. Um, but in the moment, it's still scary. I graduated chiropractic school in 2011, which was still very much, in that kind of post 2008 housing collapse recession. And banks weren't offering lots of loans. And the reality is, I I left the bubble of chiropractic college thinking that everybody wants chiropractic and all I have to do is be available to them. And I remember how disappointed I was in those first couple of months, because the numbers of like new patients and people, signing on for care and all that weren't what I was expecting, right? It wasn't what I was told. And I think the problem that we have is that in chiropractic school, we tend to surround ourselves with speakers or mentors or teachers or coaches who present it as if you only do these things, then this will happen. And you just need to follow my lead and do it this way, and it's easy. And the problem is it's rarely like that. And what happens is, I graduated and I went out into practice, and there was nobody in the world who was more confident than me. And all of a sudden, things didn't work out exactly the way it was, right? It took a little bit longer to kind of get started and get my feet, underneath me. And I remember feeling disappointed, not in terms of how I was unprepared in terms of like being, mentally aware of what it was going to be like outside the bubble. But I felt disappointed in myself because I felt like I was failing. And I think the problem is we set chiropractic students up to be disappointed in terms of their success in early practice. Yes, there are the people who go out and their first week in practice, they've got 75 patients and everything's like rocking and rolling. But for the most part, that's not how it typically works. It takes a lot of effort. There were a lot of weekends where we were out doing screenings, not like in a, want to buy a watch type of screening, but very much of just trying to get us out into the public and let people know who we were. And I was doing, church craft sales, and I was doing 5Ks, and I was doing all of these events all the time, hoping to just get our name out and let people know, what we were doing. And it was a struggle. I distinctly remember like 3, 4 months in, my wife was our front desk. She ran the office for the first 5 years before she had her first son. And I distinctly remember there was a new patient filling out paperwork in the front. And I just got off a call with my accountant. And I call my wife over, and she comes kind of right behind this little wall that we had. And I show her the first paycheck that I ever wrote to us. And we both kind of sat there and cried, because it was this sense of relief of, oh my God, this is working, right? Fast forward 11 years, and we're rocking and rolling, things are amazing, but it didn't start that way. And I think the problem is we need to be honest with people about what it's like, because a lot of chiropractic students graduate, they go out into practice, and they might have a vision for how they want to practice. And if things don't follow that exact path, there's fear, there's uncertainty, there's student loans, there's increasingly high cost of living. And it causes these people to start to add in other things. Maybe they wanted to have just a pure chiropractic practice. Well, now they need to just get people in the door. So yeah, let's bring in massage, and let's do dry needling, and let's do this, and let's do that. And there's nothing wrong with any of those things if it's how somebody authentically wants to practice. But there's a lot of people who fall into it because they weren't prepared for what things were really like in the beginning. And I think it's important that we share that, because chiropractic is amazing. And 11 years into practice, I have the life of my dreams. But it was work. It takes effort. And the only thing I can say is that that the chiropractic philosophy, not to harp on it, but that's the thing that kept me going, because I had a mission, right? Like I had a reason every day that I was getting up, beyond just I needed to pay my bills and stop living off my wife's savings. But like, we need to go and serve humanity. We need to save the world through chiropractic. And that's what made me get up and work and bust my butt to create the practice that we had. So that's why I really try to talk about philosophy to students, because that's the why. That's the reason why you get up and do all those things, even when it's not easy.
Can you speak in present moment, the refinement that you've been able to develop in your clinics? How are you practicing? Like, can you walk us through somebody's experience? Obviously, it's going to be different depending on if it's a pregnant mom or a child, but can you talk to us, bring students into your practice if you can, and try and describe it from the inside out, whether it's the systems and procedures or the teams you have, or the focus that you have when somebody comes in, or the focus you have during re-exams, just anything you could share that can help keep helping people build context in their mind of what it's like to actually practice.
Yeah. So, a typical new patient process is somebody would call up the office and schedule a complimentary consultation. We offer a complimentary consultation because I think it's the best way to connect with somebody. You have to understand that in the perinatal world, people come into chiropractic not being sure that it's what they want to do or that it's safe. They don't really know what's involved. And, that I feel like that consultation really gives them an opportunity to come in, experience the office, feel safe, get to know us, and then be willing to continue. So they'll walk into the office, they'll fill out paperwork. I always like them having fill out the paperwork in the office, because that way they can see families coming in. They see, kids fighting to see who goes first on the table. They see happy families, and it kind of just reinforces that idea of this is the right place for them. So they fill out paperwork, then they get brought back into the consult room. Either myself or my associate will come in and do the consultation. We'll review their health history. We'll review their goals. We talk to them about their their emotional experiences in terms of that. I think that's important to note, is that people don't make decisions based on what they're feeling. They get, meaning like their symptoms or their health. They make decisions based on the emotions of what they're either not able to do or what they want to do that their health is getting in the way of. And that's a really important distinction, because most chiropractors focus on, the condition that somebody might be coming in with. And what we need to be doing is focusing on, why is that getting in the way of the life that they want? And how can chiropractic, help them get that? So we do the consult. During the consult, we talk to them about what it is that we do, what most chiropractors practice like in a musculoskeletal pain relief model versus what we do in a salutogenic subluxation correction model. If they decide to get started, we do an evaluation where we do, for somebody who's not pregnant, we'll do posture with bilateral scales. We'll do the Insight subluxation station scans, paraspinal thermography, surface EMG, and heart rate variability. And then we do a x-rays. Now, if the person's not pregnant, we obviously don't do x-rays. If it's a child, we usually just focus on the Insight subluxation stations. What I'm trying to do in my exam is answer two questions. Does this person need to be here right now? Or are they currently experiencing a health crisis that needs to be referred to somebody for more immediate medical attention? The second one is, are they subluxated? So my evaluation, my exam, is ruling out red flags, finding presence, objective indicators of subluxation, right? So paraspinal thermography looks at autonomic balance from one side to the other. Surface EMG looks at the muscle engagement along the spine. Heart rate variability looks at the autonomic nervous system's ability to adapt to an ever-changing environment. Posture with bilateral scales shows how our body is adapting to the gravitational forces that are a constant in our life. The x-rays look at not just pathology, but look at the structure and the alignment and even the biomechanics of the spine so that we can understand both structure and function. Based on all of that, they come back for a follow-up visit where we sit down and go over everything. On that visit, we get them their first adjustment. Now, we want to see people as frequently as they need to in order to be stable. A lot of chiropractors have a policy where it's X number of times per week, and then we go down to here. Or, we're going to see you this many times until you're feeling better, and then we're going to do this. I really try to take an approach where we're going to see you as often as is necessary to either get you to hold your adjustments or to see a really dramatic change in your scans. I want to have objective indicators that you are holding and stable so that when we spread out your visits, it's because your body is able to go longer without that subluxation interfering with the expression of innate intelligence. So I think that's a really important thing. I usually tell people in the first visit, we're going to start seeing you more frequently, and then we're going to reduce that frequency as your body stabilizes. You can expect your initial phase of care to be anywhere from 3 to 5 months. Sometimes it's less, sometimes it's more. But at the end of that, you're probably going to want to continue, periodic, wellness type of care, maybe every couple weeks, to help your body better adapt to new challenges that will continue to bombard your body for the rest of your life. We have a lot of families that come in. Like I said, it's about 80% pregnant patients, and then most of those will bring their kids in afterwards. The other 20%, I would probably say about most of those are young kids, and then the others are the occasional husband and father. But that's kind of the gist of the new patient flow. On a typical visit, somebody signs in, they lay down, we get them checked, we make the adjustment, and they're on their way. The actual visit is not long. It doesn't take long to deliver a specific adjustment. Most of the time that's spent is either talking about stuff that's not really that important, or talking about their symptoms, which, again, that's not really the focus of our practice. We want to know if something's new or different. We want to know if something's changed. We want to celebrate their successes. We want to investigate any new issues. But we don't want that to become the focus of the practice, right? We don't want them to think that, oh, they come here when something hurts. And so my job is always, hey, you need to be adjusted today. You're subluxated. Let's make that correction. And awesome. We'll see you next week. Um, but the visits are focused on the location analysis and adjustment of vertebral subluxation and helping to keep them on track so that their body can continue to heal and function better. We're a relatively busy office. I don't like talking about numbers because I don't think it tells anything about the quality of care. But it's a busy family wellness practice where people are coming in for subluxation correction. Um, and we work with other providers to refer out for massage and acupuncture and all sorts of other things, but it's just not what I want to do in my practice.
Hmm. Yeah, no, thank you for that. I appreciate the details. Um, if we could shift to the latter part of this conversation, or the ending part of this conversation, um, it seems as if you're really engaged in the profession. You really care about the ICPA. You're almost like carrying the torch of people like Jeannie Ohm and so many of the elders that have passed away in recent years. What's your hope for the profession, and what's your maybe vision for how you see the next 5, 10, 20 years of your life? Is there anything that comes to mind creatively that you would like to see more of in the profession, or that you see already happening in the profession that gives you a lot of hope? I'm just curious where you're at with that.
Um, my professional mission is to make chiropractic available at every birth for every parent and every baby everywhere. I want chiropractic for the purpose of subluxation correction to be a routine aspect of pediatric and prenatal well-being and healthcare. Um, I think the only way that happens is if one, chiropractors are able to stay philosophically grounded in what we do versus what medicine does. Um, we can't present ourselves as an alternative to pediatricians. We can't present ourselves as an alternative for conventional healthcare. We need to set ourselves apart as something that's separate and distinct, regardless of whether you're using other healthcare measures. There's no other healthcare profession that corrects subluxation. So, how can we possibly pretend that we're an alternative or that there's, choices in terms of that? If you want subluxation correction, you need to find a chiropractor. Um, but that position also gives you a space for growth because, I've been able to build relationships with OBs, midwives, pediatricians, dentists, physical therapists who understand the value of chiropractic and refer their patients for subluxation correction. It's great when I have an OB or a patient come in saying that their OB told them to come here, to get adjusted because it'll help them prepare for birth. Um, that's the type of stuff that I think we need more of. And we need to be philosophically grounded so that we can build those relationships with other professions. I don't see any reason why we can't have chiropractors speaking at the American Academy of Pediatric Conference or speaking at ACOG, the College of Obstetricians and Gynecologists. I don't see why we couldn't make subluxation correction a routine aspect of healthcare. That's what I'd like to see. And I think the idea of saving the world one spine at a time is nice, and it's a nice thing for a person to want to do. It's what I do in my practice. But if we really want to make systemic change, if we really want to make the impact that chiropractic is capable of making, we have to expand beyond our practices. We have to change guidelines to grant access, for chiropractors to, adjust in the hospitals to take care of moms and babies in the NICU. We need to change, the consciousness of what chiropractic is, both within our profession and outside our profession, if we really want to be able to help the world in the way that we can. And so that's my goal. That's what I'm going to create.
I would love your reflection. So this project, the innovation in this project is that pre-chiropractic has existed, but it's never been fully focused on and developed in a way that gives it a robustness that a student in high school is like, I want to go to college and study pre-chiropractic because there's a whole curriculum,
Yeah.
there's a community, there's a culture, there's outcome measures, there's clear goals, and then you get to go to chiropractic school. Um, the MCATs is currently like that shiny object that has over 100,000 people trying to go and take it every year. And so I'm not proposing that we have like a CCAT, but I am proposing that we have a curriculum. And, you know, if we just use the analogy that like the first subluxation happens at birth, well, can't we just say that the first subluxation in our profession happens when an incoming chiropractic student doesn't have that clarity and insight of what chiropractic is, and they're making their decision for maybe the wrong reasons, or maybe they don't have like a really strong internal sort of strength. So I'm just curious, like for you to hear me say that like pre-chiro is really like prenatal chiropractic care, but for
Yeah.
chiropractic students, like do you
I love
see
that
how there's
analogy.
kind of a disconnection there as far as like our profession talks about helping people reach their potential, but are we really aiming to reach the potential that we have in our education system? Not that education is everything, but like the development to become a chiropractor, right? There's a difference between becoming a doctor of chiropractic and becoming a chiropractor. I mean, what you're representing is like becoming a chiropractor, and that distinction that you didn't even grow up knowing really what chiropractic was, even though your dad was a doctor of chiropractic. So I'm just curious if you can shed some light on that for a minute.
That's such an important distinction. I remember listening to Arnaud Bernier talk about I think it was Arnaud. It's possible it was Reggie. But he said, we as a profession, we have actually, you know what? I think it was Bill Esteb. Sorry, I'm just, name dropping here. But I remember sitting in a Bill Esteb class and he mentioned this, that we in our profession have too many doctors of chiropractic and not enough chiropractors. And I think that's a really important thing. You know, the thing that's unique about chiropractic is the pre-med coursework is really kind of irrelevant. Yes, it's helpful to have anatomy and physiology. Yes, I suppose if you want to understand pharmacology from a, just a basic standpoint, maybe biochem is valuable, or organic chemistry. Like, I don't really think any of those things change anything about how somebody is going to practice or how effective they are as a chiropractor. Um, but the mentality and the mindset and the philosophy and the understanding of what the profession is and what it can be, I think makes a big difference. I've been on recruiting trips for Life University when I was a student ambassador. And I remember a recruiter saying to a group of um, pre-nursing students, well, why would you want to be a nurse when you can come here and be a doctor? And I just remember being like, what are we doing? Like, I mean, even if they did come to chiropractic school and graduated, they're not going to have any understanding of, what chiropractic is as a profession. That's not where their heart's going to be. Um, it's nice to want to help people, but there's lots of ways to help people. The person who changed my tires yesterday helped me. Um, that doesn't mean that, chiropractic is the best route for everybody to become, for everybody to try to help people. I think we need to be really clear on what it is that we do and what it is that we don't, and how we fit into the healthcare profession. Because if you look at a lot of practices, um, you really can't tell the difference between them and any other provider. Um, they do manipulations. Yeah, so do physical therapists and osteopaths. They do physical therapy. Well, so does physical therapists. They do dry needling. Well, that's just acupuncture without the philosophy. They do supplements. Well, so does a nutritionist who doesn't have $200,000 in student loans. You look at most practices and you can't tell what chiropractic school was actually necessary for. Like, what's the thing that's present that you as a chiropractor do that nobody else does? Most people can't answer that. We need more chiropractors, but we need more chiropractors who are passionate about chiropractic, not just helping people. Um, there are a lot faster ways to get credentialed and be able to help people and make a living off of it with less student loans. Um, But if you're really passionate about chiropractic and this philosophy, because that's what really makes all this distinct, then there's no better profession to be a part of. Um, And I think the pre-chiropractic stuff, yeah, do the anatomy, do the physiology, let people better understand this. But man, if I had a pre-chiropractic club, I'd be playing old videos of Reggie Gold. I would having, conversations about who really does the healing when there's surgery. Is it the body, the intelligence? Is it the surgeon? I would be asking these questions and having discussions, because the more you talk about these things, the further you solidify your understanding, right? There's that expression that conflict clarifies. Having debates and being challenged and arguing with my instructors and doing all of these things is what allowed me to gain that confidence. Um, and I wouldn't have done that. I wouldn't be who I was right now if I wasn't trying to challenge people and ask questions and trying to like debate these things. So I think that's what I would do if I had a pre-chiropractic club that I had access to. Yeah, let's watch something. Let's listen to Reggie Gold, Valley of the Blind, and let's talk about it. Let's listen to James Chestnut and talk about how lifestyle factors play into chiropractic practice. Like, let's talk about these things so we can better understand what it is that we want to do, and see if chiropractic is really the right avenue for you to do it. There's no shame in people realizing that chiropractic isn't right for them as far as a career. But the problem is we don't give people a chance. We don't give people a chance to discover what chiropractic is. If you end up in a chiropractic school that doesn't teach philosophy outside of its idea as a historical construct, then man, you are being set up to fail. You're going to be set up to be practicing as an outsider in a profession that you're not welcome in terms of medicine. Um, and listen, you can be happy that way too, but I would feel so unfulfilled as a chiropractor. It would be kind of like, buying a Lamborghini and only driving it through school zones. Like, what are you doing? You're missing out on so much. So I think where we really need to get people in is, hey, this is something that's different. This isn't just, oh, we're going to adjust people instead of doing surgery. No, this is a completely different approach, mindset, philosophy. And that's the stuff that I think we need to be promoting, because I think that's the stuff that's really cool.